Hi everyone, this is Fergus. He's a 21-year-old Clydesdale and he's going to be my demonstration patient for the 7 steps. So really important to do the 7 steps when you treat your horse so you can pick up areas that need attention. So we're going to start off with the pecs to stimulate relaxed response from the autonomic nervous system. Then we're going to go to the withers, then the spine, then the hips, hamstrings, and then we're going to come up to the neck, and finally, if he gives us permission, we're going to work a little bit on his pole. Now you can either use your standard hairbrush attachment or the new comb handle, which is a lot easier because I can concentrate with the device in its pouch, which I don't have here, or a little bum bag as I have. So as you can see, the device is away and I have set the energy level to low, and I'm in the setting called sedation, so I want to calm the system. So what I'm going to do now is I'm going to sweep the pecs, and I'm going to do this side, then I'm going to do the opposite side, and then we're going to work our way through the horse. Alright, here we go. So I'm just dragging down and just watching the eyes, putting my hands on to feel the reaction of the horse. You all know this as horse owners. So as I'm looking for any spots that I get a reaction from the horse or where the device grabs. And nothing much here. And I'm going to do this 3 times. And I'm actually going to turn the handle around so I can get right under the pecs here. And his head's dropping, and I've picked up a little bit of a point here, so I'm just going to leave the device there for a minute. It's really grabbing on this point. I know you can't see it, but oftentimes you'll see the hair change direction. And so I'm going to work that through, and hopefully you'll see the little reaction there, right there. It's grabbing. And I'm just going to stay there for a minute, and I can work the device in different directions, and that's a little trigger point or knot there. And once that releases, Fergus's head will relax and drop, and you can see the reaction there. And now we'll go and do the other side. So I've got a little bit of pressure on there. I get a lot of feedback through the handle of the comb. A little bit there, so I'm just going to work that. Okay, so now we're going to scan the withers area. So I'm going to go either side of the withers here and then come down the side to about here. So we'll just move you a little bit. Thank you. Nice and slow. There's a little spot grabbing here. So I'm just going to leave it there for a moment. Now you can leave it there, or you can treat the area until you'll feel the restriction release. I'm going to work laterally either side of the withers. I'm going to do that 3 times. You can even come down to the shoulder if you want. Okay, now I'm going to do the other side. That's the withers done. So now I'm going to move to the spine. We're going to work from the end of the withers down to the tip of the sacroiliac joint down here. Now I'm going to do 3 tracks down the spine. So I'm going to do a middle, and then I'm going to do either side, and then I'm going to work down the ribs like that, looking for any points. All right, so I'll leave the hips and area for the next, but we're going to work the spine, either side, what we call the 3 tracks. So starting here, just checking and moving nice and slow down the spine. Not a lot of reaction from Fergus. Now, as far as the energy level of your device is concerned, start low and you can slowly work up. I usually keep it around 10 to 15 because especially with this hair comb, the hair comb handle, we can actually get good contact with the horse's skin, so I keep it fairly low. Obviously, if you know your horse well, you can increase the energy a little bit. So a bit of reaction here. Just going to stay there. One more time. Now hopefully you can see I do have a little bit of pressure, so I can feel what's going on and if there's any resistance. And for me, not being a horse aficionado, I've always got my hand to feel if he starts to tense up. So that's that side. Now I'm going to go to the other side and do the other side of the spine. Okay, so I'm doing the other side now, so the third pathway. So I'm starting at the end of the withers, running down, and now as you get used to using the device, you will be able to adjust your speed. Obviously I've been using this technology for over 20 years now, so I'm quite used to feeling the reaction of skin and muscle. And it does take a little bit of getting used to. It's practice. It's like touching your horse. You know what your horse feels like. You know the reactions that it gives you, what it likes and doesn't like. And he's chewing away, he's loving that. So I do this 3 times. I'm coming down the side of the ribs. And we've got a reaction there. So I think we'll get a bit of reaction when we treat the sacroiliac joint and the hips, also the hamstring. So now I'm going to work the hips and the sacroiliac joint down to the dock, and I'm going to come down about this far. So I'm going to work the device down here and then crisscross the areas here. Okay. And you can see there's a little bit more of a reaction. He's still enjoying it, but there's a point there. So once again, I'm using a bit of pressure. Down to the dock, and now I'm going to brush the hip area. And I'm going to do it in different ways. And it doesn't matter which way you do it. The whole idea is to scan the area and find those key points where the horse reacts, which could be knots, tender points, trigger points. It doesn't matter. You're looking for those points that are different to other areas. And he's really leaning towards me right now, so he's enjoying it. So now I'm also going to come down the side of the leg here. And no great reaction there. So now we're ready to treat the other side. So I'll go around the front. Now we're going to scan the hamstrings. So if you need to get close in, you can move the tail, but I'm going to work without moving the tail. Just looking for any reaction, and I'm going to do that 3 times. So I'm going to get as close as I can. He's still very relaxed. I have a little bit of resistance here, so I'm just going to concentrate brushing this area and then check that it's released. Now you can always use the trigger setting to vibrate this and massage the area. So I'm going to change my setting on this into trigger and see if we can get a reaction. Reaction straight away, as you can see. So this is like a little vibration, the trigger setting, and it very quickly releases any knots. He's fine with that. Work it a little more and then we'll move on. So when you find areas that need attention, it's always good to change your setting to an appropriate setting. So such as if you have tightness there, you want to choose a setting that will release it. Setting like relaxation or trigger. Now that has released quite a bit, so I'm going to switch back to my original setting of sedation. And I'm on energy 10, still a very low setting. And I'm going to check that area again. That's quite smooth now. And always palpate just to check that you've done the job you need. Okay, now we're going to come down to the base of the neck where it meets the shoulder. So I'm going to work here and right. He's leaning on me. So I've got a little bit of a point here. So I'm just going to work through that. Really relaxing for the horse and really good thing to do on your horses at least once a week. As a general, nice treatment to do. Nothing much there, so I'll go do the other side. Now the final point we do is the pole, and just behind the ears on the neutral line where the halter or the bridle sits. It can be very irritated for the horse, and I'm just going to work in there. As you can see, it's quite sensitive. So really light touch with your device. I'm not pressing, I'm just being gentle and running it along the pole there. And you can The feedback that you get from this handle is quite a lot, so I can feel any tight tissue just here behind the ear. So I'm just going to move the device back and forth. There you go. Then I'm going to do the other side.